Are you or someone you love taking a pill every day, thinking it's protecting your heart, but it could actually be making it weaker? This might surprise you, but one of the most commonly prescribed pills for seniors may be quietly robbing your heart of its natural strength. And if you're over 60, your body might be more vulnerable than you think. So before you take that next tablet, let me explain what's really happening inside your heart and what you can do to protect it. Hi, I'm Dr. Alex Carter. I'm 70 years old and have spent the last 45 years working as a heart surgeon, researcher, and health educator. With advanced medical degrees and decades of treating patients from all walks of life, I've learned one powerful truth. Simple, consistent habits and the right information can make a life-changing difference. That's exactly why I created this channel, to give you clear, science-backed health advice, so you can feel stronger, more energetic, and live with confidence after 60. So if you're passionate about staying healthy, avoiding unnecessary medications, and learning natural ways to protect your heart, like this video and subscribe to My Life After 60 for weekly health tips and advice. Now, let's get to today's important topic. Today, I want to talk about a pill that millions of older adults take every single day, often for years, without realizing what it might be doing to their heart. You'll learn what this medication is, why it can be harmful for seniors in the long run, what symptoms to watch for, and 3 safer, natural alternatives to help protect your heart without side effects. Let's start with what this pill is and why it's prescribed. Beta blockers such as metoprolol, atenolol, and propranolol are commonly prescribed to manage high blood pressure, heart rhythm issues, or after a heart attack. In many cases, they do save lives. But here's what most people don't realize. Beta blockers reduce the heart's workload by slowing it down. That's great when your heart is overworked or recovering from trauma. But what if your heart is already healthy, or aging, or trying to stay active? Beta blockers can dampen the heart's ability to respond to exercise, reduce your stamina, lower your mood, and in many seniors, they can even cause fatigue, weakness, and brain fog. In a study published in JAMA Internal Medicine, seniors on beta blockers were found to have lower physical performance and greater risk of falls, especially if they had no history of heart failure. That means if you're taking them just in case or for mild hypertension, they may be doing more harm than good. As we age, our bodies respond differently to medication. Metabolism slows down, so the drug stays in your system longer. Muscle mass decreases, which affects how the medication is distributed. And the heart itself becomes more sensitive to chemical changes. So what might be a standard dose for a 40-year-old can be too much for someone in their 70s or 80s, especially if they're active, walking daily, or trying to exercise. Many seniors on beta blockers report shortness of breath even while doing simple things like climbing stairs or carrying groceries, and often chalk it up to just getting older. But it could be the medication slowing your heart too much. Sometimes doctors don't realize the fatigue or depression you're feeling is a side effect. They might add another pill rather than adjusting or removing the one causing the issue. If you or a loved one is taking a beta blocker, look out for these warning signs. Feeling unusually tired, especially in the morning, dizziness or lightheadedness, cold hands and feet, depression or lack of motivation, memory problems or brain fog, shortness of breath doing everyday tasks, lower heart rate than usual, below 60 BPM. If you're experiencing any of these symptoms, don't stop your medication suddenly. That can be dangerous. Instead, talk to your doctor about your symptoms and ask, could my beta blocker be contributing to how I'm feeling? Now let's talk about what you can do safely, naturally, and effectively to help your heart stay strong. We'll go deep into 3 simple habits that have shown great results in clinical studies and in my own patients. These habits support your blood pressure, circulation, and energy without making your heart sluggish. First, beetroot and nitrate-rich vegetables. Beets, spinach, and arugula are packed with natural nitrates, compounds that help your blood vessels relax and widen, improving circulation and lowering blood pressure naturally. A study in the journal Hypertension found that drinking beetroot juice daily significantly lowered blood pressure in older adults. You don't need to juice every day. Just try adding cooked beets to your salad, a handful of arugula with lunch, or roasted beetroot as a dinner side. Beets support brain function too. Second, walking for 20 to 30 minutes a day. Light exercise like walking is better for seniors than most medications when it comes to heart health. Why? Because it strengthens your heart muscle gently, increases good cholesterol, lowers stress and cortisol, and improves sleep, all of which protect the heart. A Harvard study found that seniors who walked 30 minutes daily had a 30% lower risk of heart disease, even if they had other risk factors. That means if you're taking it just in case or for mild hypertension, they may be doing more harm than good. Third, magnesium-rich foods. Magnesium plays a critical role in heart rhythm, muscle function, and blood pressure regulation. But many seniors are deficient, partly due to medications like diuretics and partly due to poor absorption with age. Try including almonds, pumpkin seeds, avocados, dark leafy greens, and even a little dark chocolate. These foods not only support heart rhythm, but also help you relax and sleep better. Now let's tackle some of the most frequent questions I get from patients and their families about beta blockers, especially how they relate to aging and heart health. Doctor, I've been on beta blockers for 10 years. Is it safe to stop them now? This is a very common concern and a very important one. You should never stop a beta blocker suddenly without your doctor's supervision. Why? Because stopping cold turkey can lead to rebound hypertension, irregular heartbeat, or even a heart attack, especially if you've had heart problems in the past. Instead, speak with your physician about tapering your dose slowly and discuss if there is a newer or gentler alternative that better suits your age and lifestyle. Many times, with lifestyle improvements, the dose can be lowered or even stopped safely. Are there safer medications for high blood pressure in seniors? Yes, and this is something I discuss with my patients all the time. Some medications are better tolerated in older adults. These include ACE inhibitors like lisinopril, ARBs like losartan, low-dose calcium channel blockers. These often have fewer effects on heart rate and energy levels compared to beta blockers. But the best solution is always personalized. It depends on your kidney function, heart rhythm, and other medications you're taking. Ask your doctor, is my current blood pressure medication the best fit for my age and energy level? If I'm feeling tired and weak, how do I know if it's the medication or just aging? It's easy to assume fatigue is just old age, but here's what I tell my patients. If the fatigue came on after starting a medication or gradually got worse with no other changes in your life, it's likely related to the medication. Aging does cause some slowdown, yes, but you should not feel drained, foggy, or short of breath every day. That's not normal aging. That's a red flag. If you notice these symptoms, ask your doctor for a medication review. You can also request a referral to a geriatric pharmacist who specializes in optimizing medications for older adults. Now, I want to be clear. Beta blockers are not evil. They save lives, especially after heart attacks, in cases of arrhythmia, and for certain types of heart failure. But if you're taking them just for high blood pressure or mild anxiety, especially if you're over 65, you may benefit from a reevaluation. In many cases, with better nutrition, moderate movement, and stress control, you can reduce or eliminate the need for beta blockers entirely. Let me tell you about Jane. She's 74, lives in Arizona, and was taking metoprolol for mild hypertension. Over the years, she felt increasingly tired during the day, dizzy when she stood up, and uninterested in things she once enjoyed like gardening and evening walks. Her doctor attributed it to age, but when we reviewed her medications, I suggested she speak with her primary care provider about switching to a different blood pressure medication. Within 6 weeks, her energy came back. She was walking again, her blood pressure remained stable, and most importantly, she felt like herself again. This is why advocating for your health matters. You know your body better than anyone. Let's take a quick recap of today's important message. Beta blockers are commonly prescribed to seniors but may cause fatigue, weakness, and other side effects, especially when not medically essential. Seniors metabolize drugs differently. What's safe for younger adults may not be ideal for older bodies.
Hope this gave you clarity and confidence about your heart health and the medications you rely on. Tell me in the comments, have you ever felt tired or foggy on a medication? Did your doctor help you find an alternative? And if you found this video helpful, like this video to help more seniors get informed, subscribe to My Life After 60 for weekly tips on natural heart health, energy, memory, and more. And don't forget to share this with a loved one who might be taking heart medication without knowing the risks. Until next time, stay strong, stay curious, and always listen to what your body is telling you.